Do I need some aspect of a facelift or will fillers help? Early 40s. Jowls bother me a lot. Do I need some aspect of a facelift or will fillers help? Early 40s.
Thank you for your question. You're in your early 40s and you've submitted two photos showing the lower face, the front view and a 3/4 view. And you're asking, will some type of facelift be of benefit or fillers? And you specifically asked about jowls. So this is a very common issue, particularly for a lot of women in their 40s. What happens at this stage of your life? Well, there are two things, and it depends a lot on genetics, but there is basically two aspects to the manifestation of what you're experiencing, referring to facial aging. And these are two things. One is descent or sagging. That means the skin and soft tissue are sagging and drooping and is partially responsible for the jowl as well as the little band of skin below the neck, which has resulted in a loss of that nice angularity. The other part is volume loss. Volume loss as we get older involves bone, muscle, fat, skin, soft tissue. So essentially, as we get older, things kind of shrink inward. And so there's opportunities to restore volume as well as restore position. For years, there's been debate continuously between non-surgeons and surgeons about what is better at any given time. But I think that the debate has even become more complicated with the mix of a lot of devices that are being aggressively marketed to offer non-surgical solutions to avoid surgery altogether. So to make sense of all of this, what you have to kind of start with is a simple test. And that is to just physically lift the skin upward. See what happens to your jawline. See what happens to your neck. Don't do it too aggressively. We often refer to this as the mirror lift. And what you're doing is you're literally moving tissue upward to see, does that improve your jawline? Does it improve your neck? If it does, then a significant element of your concern, specifically the jowls, is related to some descent. Usually when someone has this type of situation and they're relatively young as you are, then a limited incision facelifting procedure can be considered. In our practice, we do these procedures under local anesthesia with light intravenous sedation. It's still not a shortcut procedure because deeper tissue, specifically a layer called the SMAS, or superficial muscular aponeurotic system, needs to be addressed in order to maintain the position of the skin. Now, a lot of doctors advocate deep plane, and others advocate lifts that have a particular a marketing label, a name, something/lift. But in the end, really, an experienced cosmetic surgeon who does a lot of facelifts will customize these procedures based not only on the external physical exam when you meet with the doctor, but also what is seen during surgery. A lot of decisions actually have to be made in real time during surgery, depending on the quality of the tissue and the effectiveness of the movement. But in the end, my feeling is that repositioning sagging tissue is probably the most optimal way to restore a youthful appearance when there is descent. In our practice, we do periodically also do fillers to restore volume in people in your position. And a lot of times it's because you don't quite have the time yet to do your facelift. So in the meantime, can we do things to soften the appearance of the jowls? The answer is yes. you can place fillers. In our practice, we use a material called Radiesse, and we'll routinely put it into an area that's right in front of the jowl called the mandibular notch. And right adjacent to that is an area called the mesolabial fold. And this area, which is often referred to as the marionette line, benefits from augmentation or replacement of some of that lost volume. Ideally, the sequence would be lift and then add volume. But if there is not enough time, then you can do things to restore some of that volume. So now moving forward to the restoring volume question. When your face is thin, as yours is, there are opportunities in different areas to restore volume. My approach is to always be conservative. A lot of well-known people are walking around with very swollen-looking appearance, and they think they look smooth and look attractive, but really they look pillowy and doughy. And that's not what we want. We want to try to restore just enough so that artistically the balance of your face is maintained. You just look a little younger. You look a little bit more rested, and you don't look as drawn. So I think at this point you will benefit from meeting with experienced cosmetic surgeons. I'm recommending surgeons because surgeons can do everything and that non-surgeons can do. So if the practice, such as ours, where we offer everything from advanced surgery to skincare products and everything in between, we're able to customize the plan for each patient. 20 years of practice, I have many patients who have been with me for that long, and 10, 15 years. And what we've tried to figure out is always to create the right solution for the right time, and very often to also match the patient's desires and budget. So with that understanding, it's almost like primary care for beauty. I think you'll do well with meeting with a cosmetic surgeon who is comfortable with that concept. And once you're comfortable with someone and you really trust them, then move forward with whatever you feel is right for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.